Hi, my name is Julia King-Cohn, and I'm really excited to kick off our group debate on the ethics of gift giving. I have been in this program for 2 semesters now. This is my 3rd class. I work at a clinic and elementary school for kids with autism. I work specifically with the 9 to 13-year-old age group.
Hi guys, I'm Paige Olson. I am in Seattle, Washington. I'm an RBT and I work with kids who are ages 3 to 5 right now. And this is my 4th semester.
Hello, my name is Chris Koenig. This is my 3rd semester at Ball State. I live in Maryland and I work as an RBT in-home therapy with kids aged 4 to 12.
Hi, I'm Matt Stam. I started at Ball State in the spring of 2017. I work in a private school in Maryland where I am a 2-to-1 with for kids in high school.
Hi, my name is Jessica Hudson. I live in Miami, Florida. This is my 3rd semester at Ball State University, my 6th class. I work as a staff trainer and provide supervision to our staff, to our therapist, and
awesome. So to kick off our debate, we wanted to let you guys all know about an actual real life situation that one of us has encountered at our clinics, and let you be thinking about that for the entire time that you're hearing all of the information on both sides of our debates. We had a family who would bring gifts of egg rolls for the entire clinic staff. So just trays and trays of egg rolls and amazing homemade Chinese food. When she was informed that, when the mother of the family was informed that this was actually in violation of the ethics code for behavior analysts, she stopped bringing egg rolls, but she also stopped being present for any of the therapy that her son was receiving, where she had been very, very involved and attended all of our supervision meetings. She stopped for almost an entire year. Then, out of the blue, she begged the clinical director, can I please bring in, it was a special occasion, I believe maybe it was her son's birthday, and she said, hey, can I please bring in egg rolls? And the clinical director was, said, you know what, sure. Bring in the egg rolls. All of a sudden, after the egg rolls were accepted, the mother was present once again in therapy. She came to after school conferences. She came to therapy. She came to supervision. So with that story in mind, we invite you to listen to our debate on the ethics of gift giving. So in their May 2015 newsletter, the Board of Certified Behavior Analysts provided insight to their reasoning in adding a new element to the Code of Ethics, a ban against giving and receiving gifts. Beginning on January 1st, 2016, they announced element 1.06D would be added to the code. Behavior analysts do not accept any gifts from or give any gifts to clients because this constitutes a multiple relationship.
While this addition to the code may seem reasonable, in practice it creates a lot of tension between professionals and their clients, which in turn has the potential to damage rapport. First, gifts are tokens of appreciation, and clients and families should be allowed to show gratitude for services rendered by therapists in whatever way they choose. For some, not being allowed to express their appreciation is considered to be very rude. By giving a small gift, it is important to realize it is the gift giver's way of saying thank you, and not an attempt to gain more attention from the behavior analyst. It is also important to take the size of the gift into account. While most professionals would agree that large, costly gifts are unethical to receive and to give, the most common gifts that are or are attempted to be given are very small. For example, when a client's mother brings food to a team meeting, when a client offers some coffee they just brewed, or if they give a $5 gift certificate to a store that they don't shop at. Gift giving is often motivated by seasons or special occasions. For example, Christmas, Hanukkah, Valentine's Day, or the termination of services. This may bring up some sensitive cultural issues related to which holidays a family celebrates and how they celebrate those holidays. In addition, gift giving is a social norm for many holidays. Any parent who has a child in elementary school will tell you that it is almost expected to get their child's teacher a small gift. And it can be confusing for the parent to understand that you cannot accept a gift, especially when you work in a school setting. Finally, turning down gifts can be incredibly culturally insensitive. For this reason, rejecting a gift can have negative effects on the professional relation between the behavior analyst and their client and/or client's family. This in turn can hamper the client's right to effective and therapeutic services. For example, if a parent brings food that is rejected, it could be portrayed as offensive enough for that parent to stop participating in team meetings or communicating with the behavior analyst. In the field of ABA, we spend a lot of time building rapport and trust with the families we work with. A small gift should not be something that interferes with the child's progress.
Despite the fact that Element 1.06b had already covered that any forms of entering into multiple relationships with clients must be avoided, the board felt the need to create this additional requirement specifically referring to gifts, underlining that such gifts could be as small as gift cards and food, or as extensive as vehicles and housing. While this addition to the code of ethics may seem culturally insensitive or too harsh a restriction to place on clients and analysts, it only aims to protect both parties from a potentially exploitative relationship where only a professional and therapeutic one should thrive. The practice of gift giving is incredibly complex, but in reference to applied behavior analysis practitioners, we are arguing that gift giving should be avoided based on the following 4 points. First and foremost, the Board of Certified Behavior Analysts created the Code of Ethics as a complete set of guidelines to govern all of its practitioners in order to protect both the providers and recipients of ABA services. Therefore, it should be treated as not as a buffet menu from which analysts and technicians can pick and choose the rules they want to follow. By breaking Element 1.06d, practitioners undermine the entire code by creating a slippery slope of which codes should be followed and which can be ignored, fostering an environment where other ethical missteps beyond giving and receiving gifts can thrive. Second, the exchange of gifts can hamper the objectivity of the ABA practitioner who may feel pressured to give preferential treatment to a client after a gift has been given. This preferential treatment could come in the form of allocating more therapy time to a client over others, scheduling more experienced therapists to work with the client versus newer therapists, or improving the general quality of the therapeutic environment for one client in the form of more resources or better materials, while other clients are given a more standardized basis of care. An additional affront to objectivity will stem from gift giving if multiple relationships are formed between the ABA provider and the client. The acceptance of small gifts like gift cards or chocolates can encourage larger gifts like housing or transportation and continued interaction with the client and his or her family outside of the therapeutic context. For example, invitations to dinner, birthday parties, or sporting events. Therapists who work directly out of a client's home are particularly susceptible to these types of dual and multiple relationships forming and should take extra care to guard their objectivity, even if it means turning down a gift card to a favorite coffee shop or restaurant. Next, it will be argued by those in favor of gift giving that it can be incredibly culturally insensitive to refuse a gift. However, the myriad of cultural differences when it comes to the practice of gift giving is incredibly dense and complex. For some, it is a simple gesture to make a guest in the home feel welcome, while for others, it binds and obligates the gift receiver to the gift giver. ABA practitioners are scholars of behavior, not of cultural anthropology. They should not be expected to be able to interpret what each gift means for each culturally diverse client.
According to the Oxford English Dictionary, the word gift is defined as something the possession of which is transferred to another without the expectation or receipt of an equivalent, a donation or a present. Motivation for gift giving should be altruistic, meaning nothing should be expected in return. If you were to provide a service for someone and they wanted to show their gratitude, they should be able to provide a gift that does not hold personal value or is of high materialistic value. A study done by Gatewood and Driver showed evidence that recipients of gifts showed stronger gratitude when they perceived the giver sincerely expected little or nothing in return. There should be nothing wrong with a family giving a behavioral analyst a gift such as cheap pencils or pens or a stack of blank printer paper to accommodate for the materials needed to print off behavior data sheets, graphs, and skill acquisition sheets, as long as the intention is altruistic. Gift giving is also something that is related to the release of happy neurochemicals. Gift giving has been scientifically proven to release endorphins and dopamine. These chemicals are linked to your brain's reward system, giving you that happiness feeling. A study conducted by Harborough, Meyer, and Burgaw recorded neural activity of how participants were splitting a $100 bill between themselves and a charity. Results showed that giving in the form of charitable donations is adherently rewarding. The content of the gift should also matter. Gifts should not hold too much personal value to the giver or have a high materialistic value. Previous research by Blake and Early shows patient attitudes about pharmaceutical companies giving gifts to their physicians. The study shows that drug samples, medical books, and ballpoint pens were the gifts that received the most approval by third-party patients. Gifts that received the least approval were dinners, baby formula, and cocktail parties. I would agree that these high-value gifts would be inappropriate and would lead to a multiple relationship where there is obligation tied to it, but small gifts with no motive or of little to no value should be seen as harmless and acceptable.
Lawler, Kuhn, Baker, and Large, in their Mutual Dependence and Gift-Giving and Exchange Relations document, that gift-giving reinforces a mutual relationship and tends to escalate over time, which argues against accepting any gift, no matter how small, because it tends to increase the gift-giving.
In addition to contravening the gift code, gift giving contributes to multiple relationships which are prohibited. A sense of obligation can be incredibly powerful. Once the gift giving has been established, breaking the cycle can result in someone feeling that they are no longer cared for or liked. There are so many potential entanglements and complexities in trying to adapt gift-giving norms to individual situations that it is far better to avoid gift-giving in any form, which is what the BCBA code requires.
The side against behavioral analysts accepting gifts brought up the fact that accepting gifts can lead to multiple relationships. This follows Code 1.06 under the BACB Code of Ethics. The code states that behavioral analysts must seek to resolve any issues that may arise if there is any evidence of a multiple relationship. If this is the case, then behavioral analysts can accept gifts as long as a multiple relationship doesn't occur. When accepting a new client, a behavioral analyst informs parents about the procedures they will be implementing with their child. The behavioral analyst can also include the guidelines the parents must follow, including gift-giving procedures. Parents must be informed that they are not allowed to present the behavior analysts any personal or high-quality gifts. Research has shown that patients of physicians who received gifts from pharmaceutical companies viewed gifts that were personal or of high materialistic values, such as coffee makers and dinners, very unfavorably. Patients were most likely to approve drug samples, medical books, and ballpoint pens. Another point brought up was that if a behavioral analyst decides to accept a gift from a client, then they can feel obligated to a client because gift-giving behavior can lead to preferred treatment. Whether a behavioral analyst is receiving a gift or not, there should be no preferred treatment or views towards clients. Gift-giving behavior should be seen as an altruistic trait, and that nothing should be expected in return from the receiver of the gift. Behavioral analysts should be able to accept materialistic gifts of low value from clients without judgment to that client or onto others. Behavioral analysts should never expect gifts from clients, but should be allowed to accept the gratitude a parent or client wants to show for the work a behavioral analyst does by bestowing a gift. Some concerns come to mind if a behavioral analyst is required to deny all gifts from parents and clients. What happens when you have rejected a gift from an emotionally fragile parent or have said no to a client that only wants to give you some colorful stickers? What if this scenario happens with your client that you've been working on increasing social skills such as sharing, compassion, and perspective? You could be reversing any progress you have made, as well as losing the trust of your client and the parent. Social rejection can also lead to increased aggression in some clients.
In response to the code is a complete code, not a buffet table of rules to choose from, the Code of Ethics written by the board leaves much to be desired in terms of specificity of definitions. Multiple relationships should be better defined, as well as what constitutes a gift. Let's say a family has been with a clinic for 3 years and is now moving out of state. The client has had life-changing breakthroughs that has changed the quality of life for the whole family. So on their last day, they drop off a thank you card with a plate of cookies to the clinic as a small gesture to show their appreciation. Is this common social gesture considered gift giving? How does this automatically constitute a multiple relationship? Part D of Code 1.06. Feeling obligated to a client because of a gift, in response to feeling obligated to a client because of a gift, can lead to preferential treatment. Behavior analysts are shaped to view situations rather objectively. Saying that a gift can lead to preferential treatment is the same as saying that a client with aggressive behaviors or non-involved behavior by parents can lead to less preferred treatment. In response to gift-giving behavior can lead to multiple relationships, which can be harmful for the client and therapist alike. Multiple relationships should be better defined within the Code of Ethics. If a parent gives a therapist a goodie bag with candy and a scarf for Christmas, but they never speak outside of therapy hours, aside from the occasional discussions about schedule changes, does that constitute multiple relationships? There are certainly ways to give and receive reasonable gifts and still remain professional.
Those arguing in favor of gift-giving and receiving behavior have based their stance on 4 main points: that clients have a right to show their appreciation in whichever way they choose, that the value of the gift should be used to determine whether receiving the gift would be an ethical violation, that the contextual or seasonal appropriateness of the gift-giving behavior should determine the ethical nature of the gift-receiving behavior, and that the denying the gift could be culturally insensitive and damage the relationship between the client and the therapist, ultimately harming the therapeutic environment. In reference to the client's right to express their gratitude for services provided, while the Code of Ethics outlined by the Board of Certified Behavior Analysts outlines gift-giving and receiving behavior, it does not outlaw gratitude. We argue that more work is simply needed from the standpoint of the therapist and the agency that they work for in preparing clients and their families on ways to express gratitude in ways that do not ethically compromise the therapists involved. It may feel presumptuous for a therapist to let family know how they can thank them in the future before services are even rendered. However, a simple conversation during client intake or even a written document in the intake package for a new client could explain that therapists and their supervisors are not able to accept gifts at any point during the time that they are providing ABA services. The explanation would specifically reference the code, explaining that by not engaging in gift-giving behaviors, clients and their families are helping practitioners to strive for the highest levels of integrity and ethical excellence in order to better serve their clients and community. This communicative antecedent intervention before the gift-giving behavior has occurred would help therapists to avoid the uncomfortable consequence of denying a gift after it has already been given. By proposing that ABA practitioners could wait until a gift has already been given and deny or accept it based on its value, the team arguing in favor of relaxed gift-giving restrictions is actually suggesting a far more awkward and potentially damaging denial by the therapist to the gift giver. While accepting a $5 cup of coffee may seem like less of an ethical violation than accepting a $500 iPad, putting a therapist in a position to deny a very valuable gift that a client may have worked very hard to afford could be far more damaging than denying a $5 cup of coffee. Once again, we propose that the antecedent modification of communicating with clients that gifts, no matter their value, cannot be ethically received by ABA practitioners would be the better intervention than allowing the gift-giving behavior to continue on a case-to-case basis. Such an intervention would also help keep practitioners ethically compliant during times of the year when gift giving is seasonally motivated. For example, Christmas, Hanukkah, Valentine's Day, etc. In addition to initially priming clients and their families to not engage in gift giving behavior around these times of year, an ABA agency could provide the template for a heartfelt thank you note if the client and their family would like to fill one out for their therapist. By providing the template, the agency would even be removing the pressure to spend money on a card. Client feedback forms could be provided throughout the year where clients could express their concern or gratitude for any services provided. Finally, while the team in support of relaxing rules surrounding gift giving argues that refusing gifts can be incredibly culturally insensitive, we maintain that the complexity of different cultures when it comes to gift-giving traditions is far too complicated to navigate on a case-by-case basis. In his blogs on business relationships, Neil Payne explains that gift-giving from Japanese and Chinese clients is expected to be reciprocated, and in both cultures, expensive gifts are normally and frequently expected. Giftopedia, a website dedicated to explaining gift-giving customs around the world, explains that with Indians, gifts should never be opened in the presence of the gift giver. Italians would be offended by gifts given in uneven numbers, and if the gift was not opened in the presence of the giver. Saudi Arabians, on the other hand, would never present a gift with their left hand and would be offended if you did so. These sometimes stark and sometimes subtle differences in gift-giving traditions underline the complexity that an ABA practitioner would have to navigate in an already very complicated field. We again suggest better communication between ABA therapists and agencies and their clients before gift giving has even had the chance to occur as an optimal antecedent intervention to decrease gift giving behavior.
The BACB Code of Ethics states that behavior analysts do not accept gifts from clients because this constitutes a multiple relationship. The term multiple relationship isn't defined in a way that lays down the boundaries for what is or is not acceptable in terms of gift giving. There aren't any examples and non-examples of what constitutes as a gift, which leaves both parents and behavior analysts confused. Let's say a behavior analyst is recording data and their pencil breaks. Is the parent not allowed to give them a new one because it constitutes as a gift? What about if a behavior analyst works in the client's home and uses their bathroom? Is it considered to be a gift if the parent tells them to try their new scented lotion or if they use their soap to wash their hands? These boundaries need to be clear and precise for both the behavior analysts and the parents to understand. One thing that can be stated through, though, is that gifts hold a lot of personal value, or gifts of high material value should not be given. Previous research has shown that patients of doctors view gifts from pharmaceutical companies such as dinner, baby formula, and a cocktail party as inappropriate and should not be accepted by doctors. Similar to our field, gifts such as ballpoint pens, books for the kids, and drug samples were viewed mostly in favor as appropriate gifts. Gift giving can be heavily motivated around the holiday season, and families should be able to show their appreciation and gratitude for the behavior analyst working with them. Families need to know that gift-giving behavior should be seen as altruistic and that nothing should be expected in return. Behavior analysts need to know that they should never feel obligated to a client or feel the need to give preferred treatment when they are given a gift. If a family's quality of life drastically improves because of the work of the analyst and the therapy team, it is common in many cultures to want to express that appreciation. Families should be allowed to show their gratitude toward a behavior analyst by providing a gift of low material value and not personal to the family. Denying a token of appreciation may be off-putting to someone who has put a lot of thought and consideration into a gift or who truly feels as though they have no other way to express their gratitude. Denying a gift may do more harm than good. Previous research has shown that social exclusion and rejection can lead to an increase in aggressive behaviors. It is better to accept a small gift, or rather accept a gift and not use it or throw it away, rather than reject a gift and cause a negative consequence. Rejecting a gift could also be disrespecting someone's culture, causing a rift in a relationship, and even potentially result in reduced services for the client because of the damage that was caused by the denial. This is perhaps our largest argument, and that the conflict that arises from rejection of a gift can cause damage to the rapport that we have built with families. This is such an important aspect in the client's treatment, and a small gift should just not interfere with the child's progress.
You should be proactive. Inform the clients at the start that no gifts will be received because the code absolutely forbids it. Be clear about it yourself so you do not stumble or stutter with your clients. You do not want them to feel like you are making exceptions or singling them out in any way that is inappropriate. And that's from should you accept gifts from your client. This and other steps are proposed by Emily McClough in her article, 3 Things You Can Do Instead of Accepting Gifts from Clients. You can offer an alternative in an email, alerting the clients about the no gift rule. Offer them an opportunity to say something nice or give feedback to you. 3, kind words are appreciated and can be very satisfying for the client, and can give the therapist feedback on the services, which in turn can help them improve their professional work. 4, give them a printed card that explains clearly the reasons why no gifts can be accepted. Cite the code sections and go into detail about the slippery slope of multiple relationships. BACB, and the code is BACB 1.06D. Behavior analysts do not accept any gifts from or give any gifts to clients because this constitutes a multiple relationship. And 5, include a no gifts clause in the client/therapist contract. This is a legally binding document on the part of the parties, so any attempt to give a gift can be politely refused based on this contract. The code specifically forbids accepting gifts. As Turner, Fisher, and Lucille say in their article, towards a competency-based, ethical, and socially valid approach to the supervision of applied behavior analysis, analytic trainees, BABC code and other ethical code allow for interpretation and professional judgment, but not when it comes to sexual relationships with a client, fabricating data, plagiarizing, or accepting gifts.
And that concludes our debate on the ethics of gift giving in the field of ABA. So we want to hearken you back to our original story and real life example about egg rolls. After everything you've heard here with myself and Matt arguing in favor of the code as it stands, while Jessica, Paige, and Chris were arguing for more relaxed gift-giving guidelines, what should our real life clinicians have done, given their very zealous client family who wanted to give them all of the egg rolls, whereas the code specifically says no. Do you feel that the consequences of the family removing themselves from the presence of their son's services was too disastrous of an effect by saying no to a simple gift of Chinese food? We really look forward to hearing your response to our debate. We appreciate the time that you have spent watching and engaging with us. Good luck to everybody else on the rest of your semester.
Bye, guys.
See ya.
Bye.